Number 21. The group leader is teaching a child with Down syndrome to dress herself. What are some techniques that should be utilized to facilitate learning this skill? The answer is, some techniques that should be utilized to help a child with Down syndrome facilitate dressing themselves is breaking down the process into simpler steps. An example of this would be the backward chaining method. Another technique is using prompts, either physical, verbal, or gestural, and also using graduated guidance and forward chaining as well as a continuous reinforcement. Number 22. A client can make sounds, does not put on clothing independently, is incontinent of bowel and bladder, and does not follow basic commands from the staff. What is the first skill that the group leader should teach the client? The first skill that the group leader should teach the client is basic commands. Number 23. The group leader is teaching an adolescent client with a developmental disability what clothing to select each day. What are some suggestions to make? The answer is some suggestions the group leader can make is check the weather report, carry a light jacket during transitional months, like early spring or late fall. Carry clothes that are comfortable and easy to manage, like simple t-shirts, pants with elastic on the waist, and shoes with Velcro. Number 24. How and where should the sci-tech teach a client to brush his or her hair? The answer is, the sci-tech should teach a client to brush his or her hair, after modeling the behavior for them and doing it in the bathroom in front of the mirror so the client can see the results. Number 25. The sci-tech has developed a program to teach self-dressing skills to a client with a developmental disability, using backward chaining. What should be taught first? The answer is, using backward chaining, what should be taught first is the last step. The last step would be buttoning the last bottom button. 26. The group leader is teaching a client to put on trousers using the technique of backward chaining. What is the sequence that should be followed? The answer is, the group leader teaches a client to put on trousers using the technique of backward chaining. The sequence that should be followed is pulling up pants up until 2 inches below the waistline and requiring the client to pull up to their waist. Number 27. A client with a developmental disability lacks the skills for putting on a t-shirt. The sci-tech uses the technique of backward chaining. Which step would be taught first? The answer is, the step would be taught first since it is backward chaining is tucking in his shirt. Number 28. The psychiatric technician is planning to teach a client to tie shoelaces using the technique of backward chaining. What step should be taught first? The answer is, when the psychiatric technician is teaching the client to tie shoelaces using the technique of backward chaining, the first step that should be taught is to pull both loops in opposite directions. Number 29. What should the group leader focus on when teaching activities of daily living, ADL, to a client with a diagnosis of severe mental retardation? What the group leader should focus on when teaching activities of daily living or ADLs to a client with a diagnosis of severe mental retardation is to focus on scenarios the person will encounter in everyday life that are achievable to them. Self-help skills are a top priority. Number 30. Clients with developmental disabilities often have difficulty learning to pay their own bills. What is a common reason for this? The answer is, clients with developmental disabilities often have difficulty learning to pay their own bills. A common reason for this is because they have difficulty with mathematics. This may be due to them being arithmetic deficient. Number 31. What approach is best to take when teaching a client with a developmental disability to sit quietly during meal times? The answer is, the approach that is best to take when teaching a client with a developmental disability to sit quietly during meal times is to let them know your expectations and reinforce appropriate behavior. Number 32. What is the best time and place to teach dressing and undressing skills? The answer is, the best time and place to teach dressing and undressing skills is in the morning, when they are getting ready for the day, and at night, when they are changing to sleepwear in the bedroom. Number 33. When working with an adolescent client to wear clothing that is appropriate for the weather, what approach would be best to take? The answer is, check the weather report, carry a light jacket in the spring or fall, and carry umbrella if there is a chance of rain. Number 34. A client with a developmental disability is mute but has indicated non-verbally an interest in shopping for clothes. Which approach is best to take? The answer is, the approach that is best to take for the client who is mute and has indicated non-verbally an interest in shopping for clothes is to take clients shopping, give suggestions, watch for non-verbal cues, and assist with purchase. Number 35. A client on residence 33 is ambulatory and follows directions, but has poor verbal skills and no money management skills. What is the best approach to take when going shopping with a client? The answer is, the best approach to take when going shopping with a client who is ambulatory and has poor verbal skills and no money management skills is Have the client pick out the item they want, but the staff with the client has the responsibility of handling the money and buying out the items. Number 36. A client with a developmental disability is scheduled to have dental work done in the community. What should the staff do to best prepare the client for this visit? The answer is, what the staff should do to best prepare the client with a mental disability is to arrange a tour and accompany the client to the office prior to the visit. Number 37. The client has successfully completed objectives to fill out a shopping list for groceries. The next step of training is to learn how to select and purchase groceries. Where should the training take place? The answer is, the next step of training is to learn how to select and purchase groceries. The training should take place at the grocery store in the community. Number 38. On a trip to a fast food restaurant, a client with a developmental disability has difficulty deciding what to order. What action is best for staff to take to facilitate placing his order? The answer is, the action that is best for staff to take to facilitate placing an order for the client with a developmental disability is to assist client select food, look at pictures, describe food, and make suggestions. Number 39. A developmentally disabled client with mild cerebral palsy is attending the last year of high school. At the student's IEP, the team recommends transitional services be initiated. What are some examples of transitional services? The answer is, some examples of transitional services are adult education, like college, or vocational, like a job or skill training program. Number 40. A client with mild cerebral palsy has been attending high school. As part of a transition service for this client, what are some skills that would be most beneficial to teach? The answer is, some skills that would be most beneficial for the client with mild cerebral palsy are vocational skills. This includes computer skills, photocopying, filing documents, fix small appliances, warehouse work, or delivering mail.